So welcome. Welcome to our seminar on Veterans Federal Benefits. We're pleased that so many of you could make it. Last time we did this, we had a much smaller crowd, but I think the word got out about the value of the content that Thomas will share with you. So we're pleased to have all of you here with us today. I'm Jerry Hafer. I represent AMAC and the AMAC Foundation. Just out of curiosity, how many of you are aware of AMAC? Excellent, excellent. Those of you that are not, there is information out on the table that I would encourage you to pick up. Explains who we are and what we do, and explains some of the projects that we're involved in. AMAC is the Association of Mature American Citizens. We are the conservative alternative. I won't say to who. But we are the conservative alternative, and we represent seniors in Washington. We have roughly 1.5, a little bit over 1.5 million members. We're growing rapidly. And we basically represent senior interest in Washington on issues like health care, Social Security, issues that are very important to seniors. And we spend a lot of time with Congress people, drafting bills, helping them draft bills, and taking a position that is in support of seniors. And we are very active in Washington. We're up there week in and week out. So that's what AMAC does. AMAC Foundation is the nonprofit arm of AMAC. And our mission, very simply, is supporting and educating America's seniors. And we do that in a number of different ways. One of them is conducting a seminar series like this today. We do on average, about 2 seminars a month on topics that are of interest to seniors. Veterans benefits is an example. We do seminars on Medicare, Social Security. We do fun kind of seminar, well, not really fun, but seminars like cutting the cord, getting rid of your cable company. We do that periodically. We'll have another one of those in February or March, but we usually get about 100 people in every one of those because I haven't found anybody yet that likes their cable company. So we do a lot of those kind of seminars on technical issues important to seniors, assured living, smart home technologies, that sort of thing. But as I said, we do about 2 seminars a month on average. We also operate a Social Security advisory service, basically oriented toward people that have questions about Social Security or aging into Social Security and can't get information that they need. We have 5 people on staff that are trained and certified to answer Social Security questions. And we handle on average more than 300 inquiries a month of people that either call us or email us and say, hey, I'm turning 62 later this year. What are my options? What do I need to know? And we answer those questions. We do the research and answer those questions. So that's a very popular service that we have. We also do a number of publications. We just published a book called Ask Rusty, which is similar to Ask, what's the one in the popular one in the paper, Ask Heloise or something like that. But we take questions that people have posed to us and we provide a researched answer. And so we just published a book of those. So that's fundamentally what we do as a foundation. We are a 501c3. We take no federal funding. We basically operate on contributions from AMAC members and from the public. We do not charge for any services. Everything we do is free of charge, including the refreshments. And I want to point out, and the refreshments are compliments of my granddaughter. Well, not really compliments of me, but provided through my granddaughter. One of the price of having grandchildren is you got to buy a lot of Girl Scout cookies. So I got the notice last week, and we had a seminar coming up, so I said, I'm going to solve 2 birds with 1 stone. So, but basically, that's what we do as a foundation. And we're pleased to have Thomas with us today. I do want to show you one thing on our website before we get to the presentation. Our website is amacfoundation.org. And at the bottom, if you go to that website, at the bottom, you'll see a subscribe button. And I would encourage you to visit that and subscribe. That'll put you on the list for our monthly newsletters. And on our monthly newsletter is where we announce upcoming seminars and other items of interest. It's a brief newsletter. It's basically a 1-screen. but then it links back to announcements that are on the website. So I would encourage you to visit the website and subscribe, to that newsletter. Some of the other items on our website are, of course, the events page. It's kind of slow. On the events page, we outline all of the upcoming sessions that we have scheduled, where they are, how to register, that kind of thing. We also have videos on there. We're live streaming this seminar today, and this is an example of a seminar we did back in November. We will post the video from today on the website, so if somebody could not make it today, they could watch it live on the internet, or they could watch it after the fact on the website. We also have a page called Interesting Information. A lot of material, a lot of general information material that is interesting to read. So that's our website. I don't want to spend a whole lot of time on that, but I do want to get into our subject for today. And I'd like to introduce G. Thomas Spencer. Thomas Spencer is a Veterans Liaison with VITAS Healthcare. He'll talk a little bit about VITAS. He serves the veteran communities in Lake and Sumter counties, and he's a conduit linking them to the benefits and services available from both state and federal sources. Thomas is a highly decorated veteran of multiple foreign combat theaters, extremely well versed in the benefits that are available to seniors. So I'm not going to take any more of his time. I'm going to let him get started. And some of you I know don't have handouts. They're on the way. We had some unscheduled people that did not register, so we ran out of handouts, but they're on the way. They'll be here momentarily, and we'll see that you get them. So with that, I'd like to introduce Thomas Spencer.
Good morning. It's funny because when I was here last, we had maybe 15 to 20 people here, and when I came in, they were telling me, I said, well, we're expecting somewhere between 48 to 50. But then that went from 48 to 50 to what I am looking at now. I am so glad to see you out here. One thing that I like about it is I see some familiar faces that were here last time, so that meant I did somewhat well. And then when I saw all of these new faces showing up, I was like, okay, I got to bring my A game this time. I definitely can't make a mistake when I'm saying anything because it's a great honor to actually be here before you. As he mentioned, my name is Thomas Spencer. I'm retired from the Army. I retired back in 1998. I was in military intelligence my entire career, and it was a career that I loved. It was something that it became what my true calling was as I looked at it, because I wanted to, I love to say it because it's something that comes from the heart. I was able to serve something greater than myself. And then when I left, I felt like I was a better person for what I was able to do, and more so what it was able to do for me. After I retired from the Army, I then went and I began working at the U.S. Department of Veterans Affairs, that infamous bureaucracy that we are all oh so familiar with as to how they give you no information, but love to tell you no because they didn't tell you anything. Well, I'm going to work through a lot of the things that they have that are confusing that they had before, that have been really very much energized to where they do nothing but actually help the veterans now, far more so than what they were in the years before. One of the other things that we'll cover today that's one of my favorite, and I'll probably hit it throughout there, but it's one of the ones that I think is a really powerful one that occurred back in October of last year when our president signed and changed the policies with regard to personal choice with regard to Veterans Affairs. They gave a new avenue where vets, if they choose to not make use of Veterans Affairs medical services as an example because of a myriad of reasons, there's a way that you are able to actually make use of a doctor in the private sector that's closer to you, and Veterans Affairs takes care of that on your behalf. It's an incredible benefit, and that's one of the ones that I love that's a strong one, because I make use of some of that now simply because I just don't want to drive all the way to Lake Nona. It's just a little bit too far away. Well, I'm here today because I was invited for the second time, which I felt was a great honor, to actually come and speak to you. And from AMAC, I work for VITAS Healthcare. VITAS Healthcare is a hospice-based entity where we take care of patients who are on who've been diagnosed with a terminal condition, and we come in to give them assistance, not so that they can just be cared for, but so that the last years of their life, months or years, are some of the most memorable, and they get everything that they were looking for out of life in that timeline. That's one of the things about VITAS that I love. One of the other things from VITAS that I love is VITAS is a Latin word, which means life. That also is something that's important to me, because not only is it that we care for all seniors, but we provide the life at the end so that they can actually remember, reflect, and be there for their families. One of the other things about VITAS that I find that's a great thing is they were the pioneers of the hospice industry. We were one of the ones that actually were on the forefront of it even being created to being what it is today, the largest in the country in multiple states. Being part of AMAC was something that I love being a part of as a member myself, being retired. I came upon the knowledge of AMAC from a radio host, Mark Levin, whether you know him, like him. But that's where I first heard about it a few years ago, and I jumped right on it so that I would no longer be a member of that other organization that thinks it's for retired persons. This is a book that Veterans Affairs used to send out to veterans all the time. Until budgetary restrictions, they stopped making those books, and then they make them where it's online now. I believe this one has listed on here is 2012 was the edition when they had them last. I think it was 2013 was the last year that they actually published the book itself. Now they have it online, and it is relatively impossible to find it the way they have it listed on there. And I'll get into how they put it there, but I still have yet to figure out why they did it that way. Now, these are the sites. One of the things that's really great with regard to the VA.gov, they've really streamlined the way that website works now in contrast to how it used to work. VA's website before was just a collection of a whole lot of myriads of information in categories that weren't really highly organized, in my opinion, especially from working there as well. But they really streamlined it so that you can have direct access and do a lot of things on the website now that you were never able to do before. Now, I know for myself, I'm not the most internet savvy person. I have my kids and my grandkids that come over and help me do a lot of those things simply because that's not my avenue. But for those who are familiar with the website or have access to those who can assist you with it, va.gov is a great location to do that. Another one, which is a strong one, which is archives.gov. That's one of the ones that I find it's a great website, primarily because what it gives you is direct access not only to your military records and that you are able to have the federal government send to you, but you're also able to get replacements for all of your medals. That's something that to me is a great thing. Whatever medal you were ever awarded, and something that I've also learned, there's times that you could have been awarded a medal that was actually finalized after you got out that you didn't even know you had. But it's on archives.gov. And then not only will you get a copy of that medal, but you'll get a new updated copy of your discharge papers where it shows that that's on there. And a lot of vets don't know that that exists. I didn't know about that until about 10 years ago, roughly, when I found out about the archives.gov. And that's when I went on there and I was getting mine. And unbeknownst to me at the time, there was, before in the military, they had the combat infantryman's badge and they had the combat medic's badge. Well, they created a combat badge for those who were not in either the infantry or the medics, where it's a combat service badge. It's like a dagger, so to speak, or bayonet that's given to everyone. Well, I didn't know that. I served in intelligence. I didn't get one of those. However, because that was one that was created after I served, but was given back to those who served before me, before it was actually given out, I was eligible for it, and they gave me one of those. I took that as a high honor because I didn't even know it was something that was being given out to those who served. But the only reason I learned about it is because I was on archives.gov and found out. And again, it's free. That's one of the other parts that's great. Not only are your military records, but also your medical records from when you were in service. Now, there is a period from, I believe it was in the late 60s, early 70s, where some of the records were destroyed from a fire that occurred. One of the things that is great with regard to archives.gov, a lot of the records that were destroyed were in the records keeping facility. Department of Defense also has some copies of records that were separated from those, but were also the same records that's on there. On archives.gov, it accesses all locations of medical records. So I can't promise that everything can be found, but you would be amazed at how much is salvageable and findable from the Department of Defense, because they also keep records there as well. The other is with regard to the Florida Department of Veterans Affairs. One of the things that they do, which is a little different than the U.S. Department of Veterans Affairs, the state Veterans Affairs, what they have is some incredible benefits for vets, primarily if you're service-connected disabled, based on percentages. And if you're at 100%, then the benefits are exponential. If you're anything under there, but you're still eligible for quite a few things, such as free access to all the state parks in the state of Florida. And that's just a matter of going to any state park, anywhere in the state, doesn't matter which one it is, taking a copy of your DD-214, of course, and a letter that states you are service-connected. Now, where do I get this letter? Archives.gov. It's free. You go in there, and you can download it and print it out yourself, and then take that along with it, and that is enough to satisfy getting that pass. One of the other things that they have for this one, depending upon your disability rating, there's access to getting free fishing license, hunting license, the fishing being saltwater or freshwater. If you're at 100%, then you become eligible for not paying property tax anymore, ever. I love the word ever. If you are service-connected disabled at any other rate other than 100, you get a homestead, which is a significant discount from your home, your property tax, forever until you become 100%. Something else that you get based upon your disability rating from the state of Florida, if you were injured, or especially if you received a combat service ribbon such as a Purple Heart or any Medal of Valor, not necessarily the Congressional Medal of Honor, but it could have been a Bronze Star, Silver Star, Soldier's Medal, anything of that nature, the veteran and their spouse becomes eligible to go to college in the state of Florida at any state college, like Florida State, University of Florida, Miami, anything of that nature, tuition free, and that includes room and board. The cool part is once you hit 100%, as an example, not only is it you, but it's you, your spouse, your children, and in some circumstances, your grandchildren also are eligible to go to college in the state of Florida at no cost. Room and board, tuition. I always looked at that as a great benefit, but a lot of vets don't know that that exists. One of the things that I like to try and do, especially with what my job is now, is to get out and make vets aware of a lot of the benefits that they have, but have just been blanketed away from them from knowing that they exist. To become eligible for any of the things that the military offers, that Veterans Affairs offers, these are the conditions, if you will, of the contract to get anything from Veterans Affairs. First and foremost, you must be discharged from active duty service. That means active duty service does not necessitate that you had to be on active duty in the military. Active duty by this definition is if you were in the National Guard, if you were in the reserves, if you served in the military and were discharged other than dishonorable, you're eligible for Veterans Affairs. Those two criteria, you are eligible. A lot will come to me and say, well, what if I was dishonorably discharged? Am I still not eligible to receive anything from Veterans Affairs? Not exactly, because Veterans Affairs has three departments in it, if you will. There's Veterans Affairs, which is the entire entity. Inside of that entity, there are three elements to it. There's the VHA, which is the Veterans Health. That's where you get the medical. They have VBA, which is the Veterans Benefits section of it. And then there's, of course, the burial, which is the other VBA, we'll get to all three of these. Now, the VBA for the benefits section has a particular element in there where they work to appeal that discharge and take it from dishonorable to general with honorable conditions. The moment that happens, you're eligible for everything at Veterans Affairs. So I always tell people, if you served, make use of Veterans Affairs because it's there for you, and it's not as cumbersome as a lot will think it is. One of the other things that comes, and I was asked about it a little earlier, and it's something that I'll go into it a little more detail as we go through here, is it was once believed, I always tell people, some things I'll refer to as myths, because at one time it was true, but then just as a myth, the story expands and gets a little wider, and people begin to believe what's not a fact anymore. It used to be said that if you made too much money, or if your income was over a threshold, you were completely ineligible for any services from Veterans Affairs. That's not true anymore. That was removed. The threshold that exists now is only in place to determine whether or not you will have a copay. And that copay is based on the same as if you have Blue Cross Blue Shield, Aetna, or any other health insurance. You go to see the doctor, and it's like $10 to $15, maybe even $20 copay, depending on what it is, if it's a specialist or something of that nature, and you get the services rendered. Now, I always tell people, when you file and you get into there and they say, well, yeah, you're a high income, so you're going to be paying, X copay. Also remember, you are eligible for disability services from Veterans Affairs as well. And that disability service comes into play from anything that may have occurred to you in your body while you were in the military. And I always tell a lot of vets when they go, well, nothing really happened to me. I worked in military intelligence. So I wasn't in the infantry, I wasn't in the front line under fire on the constant, but I still sustained damage while I was in there. Anyone who served in any capacity, it doesn't matter what you were, if you walked, carried a rucksack. There's no one that I know that went, anyone that was in the Army, there was no point where you were not carrying a rucksack with a whole lot of unnecessary stuff in it that was painful on the back. I remember, even if it was just basic training in AIT, at some point you did do that. Guess what? Over time, your back is going to remind you that you were carrying too much weight a few years ago. And you're going to go, oh man, when I get up in the mornings, whew, my back used to not feel like this. Well, guess what the trigger was? From when you were in the service and you carried heavy equipment. And then what you do is you file a claim with the Department of Veterans Affairs to get compensated for that. The moment your claims and the amount of your service-connected disabilities go above 30%, and a lot of people go, wow, that's a high number. It's not. It's not. Some of the most basic claims that get those numbers over 30% are when they claim things like tinnitus, ringing in the ear. If you're in the infantry, you're going to get it because of loud sounds. If you're in artillery, you're going to get those kind of sounds. Your back, your knees, your feet, road marches, PT, anything you're doing in the military, trigger for a lot of the service-connected disabilities that you're eligible to receive compensation for. And that's up for a lot of the benefits. The moment you go over 30%, you don't pay co-pays anymore. You don't pay for the medications that are issued to you anymore, whether it's related to the service-connected disability or not, because you've just moved into a new category as a service-connected veteran. Amazing. And it also includes all 5 branches of the service. Something else that is also a myth is that you had to serve during a wartime episode and have been in a combat field. That too is a myth. All that you needed to do was serve your country. That's it. Be it war or be it peace. That's irrelevant as to where you were when the service occurred. As long as you were in the military, discharged, or anything other than dishonorable, you become eligible for everything that the military has to offer. As I mentioned, those are the types of discharges. You always want anything here or above. You don't want anything down here. If it's anything that's down here at the bottom, dishonorable and bad conduct, those would need to be appealed by the veterans benefits side so that you can become eligible to receive everything. So I always tell people again, if you've served, you are eligible. If you're in some trouble while you were in there, then you use Veterans Affairs to appeal that decision and get that thing upgraded. I'm going to take this jacket off because it's hot. I'll go a little less formal. Much better. Separation papers. A lot of times you've heard, like I mentioned, the DD-214. That's the more common era discharge paper that the military uses. I think they started using that probably around about the Vietnam service era. But the ones before that, they would have just discharge papers. They looked a little different than the DD-214 that they have now. Any of those are satisfactory that shows that you did serve in the military. If, as an example, you were in that era where the military records were destroyed and you don't have a 214 or your discharge papers, that's okay. If you have any documentation then that shows that you were in the military, it could be an award you received. Anything that has governmental information on it will verify that you did serve. Some of the times that I've run into some of the vets that, one as an example, was he was a World War and he did not have his discharge papers. And ironically, some of his were destroyed during that era. But what he did have were 2 medals that were issued to him, the orders that they came on. And that satisfied as evidence that he did serve in the military. Whether he was honorable or dishonorable became irrelevant because they couldn't prove that he was ever dishonorable. And he received a medal. And I always looked at it, and the argument was, you don't give medals to people who are going to get discharged dishonorably. So that satisfied the evidence base that he did serve in the military and became eligible and received his benefits. One of the others that can be done in the event that let's say the vet is incapable of producing those things. A relative of the veteran, next of kin, doesn't necessarily have to be a spouse, it could be a child, cousin, brother, anyone who is related to that veteran can do the filing online at archives.gov to get the request for the discharge paperwork. If they can't find the discharge paperwork itself, they will find something. Always there's something on you. I always tell people, if you served in the military, there's a document on you somewhere in there. Because if you remember like I did, when you went in, you signed 600 sheets of paper when you went in there. It's impossible that all of these pages are gone. If you've seen the X-Files, they always have files on something. Once those things are done, you just send them in, and it's all done online. And then they have a form that you print, that you sign, and you fax that one to them. And then everything is then up and flowing for whatever your request is. If there's any assistance, or if the family doesn't know how to do those things themselves, one of the best things smoking that I love to, and I highly recommend this to all the vets, is that first one right there, Veteran Service Offices, a VSO. Now, here in Sumter County, Lake and Sumter County both, I actually rephrase, all counties in the state of Florida have a Veteran Service Officer and a Veteran Service Office. County, they in Tavares, it's at the county headquarters where the courthouse is. Same thing in Sumter County. They have staff that are there that work on your behalf as veterans, and they do the filings on your behalf electronically. The reason they do it electronically is, I don't know if any of you have ever done a VA filing yourself, where in the past we would do it on paper and you would send it in the mail, and it would take months upon months upon months. And then when you do a question going, well, what happened to the claim or the file that I had done? And they give you I don't know, I didn't see it. It got lost in the shuffle. The electronic version of it, there is no more of that, because there is an electronic signature and tracking number placed on it. They have to find it. They're going to be punished for it. I worked at Veterans Affairs. One of the things that was an annoyance was some of the staff, they were the clerks that were up front that would take the documents from the vets that they filed. Or there was the income document that came in where you had to evaluate the income of the vet. The vet would turn it in, let's just say May 1st. And then it comes up to July. That vet's heard nothing. So they come in and go, well, I turned it in back in May. And, I come up and I say, well, let's take a look at what's going on. Then I go and find Joe Snuffy, who had that file, and there's a stack of them on his desk, yay high, that he hasn't done any of them. This is one of the problems, in my opinion. This is an opinion, not a fact, an opinion. Let me state that again, opinion. That federal employees, I was one of them, once you first get hired, in your first 3 months, you can get fired for anything. You come in and you sneeze wrong, you're fired, go home. After 6 months, they need a pretty good reason to get rid of you. But after you become tenured, after that first year, it will take an act of Congress to get you fired. And with that becomes complacency. And then the complacency causes things to not get done, which is what led to the electronic filing and holding accountable. One of the things that I've learned, whenever you call Veterans Affairs for something, there are two types of employees that work at Veterans Affairs. All of them are federal employees. But you have the civilians that work at Veterans Affairs, and you have veterans that work at Veterans Affairs. Who do you think would have your best interests at heart when you call? Clearly. That's when I've heard when people go to Veterans Affairs and they want to go and file for getting there to become using the services of Veterans Affairs, and then they're told, you make too much money. No, you make too much money, so you're going to have a copay. Not you make too much money, you get no service. I always tell people, that's like Blue Cross saying, well, we'd like to insure you, but you make too much money, so we don't really want to service you. Logic in that. What it is if you don't really want to do the work, I don't think you should work at Veterans Affairs. That entire branch was designed to support those who served their country. And when it comes their time to be served, that should be the prime directive, not I just don't feel like doing it. When I worked there, it was just something that I took on as an honor because I was serving those that also served. And they also had this thing at Veterans Affairs, I think they phased it out, but it was called Champus. And that was a health insurance where wives of veterans, I think they phased it out after the Vietnam era, but it was place so that the whole family would have access to Veterans Affairs and make use of it. Now, those who had it still maintain it, but I don't think they've continued that plan anymore. But it was incredible service that they were giving to veterans. But what was going on is people who were working there were just not sharing information, and they were making it more and more difficult for the services to be provided. These are the discharge papers I was speaking about. Now, this is another one that's a really good one. The Veterans Marriage Certificate. Why would that be important? Why would they want to have a Veterans Marriage Certificate? Primarily because services that are available for the spouses. I'll get into some of that a little later, as well as the Veterans Death Certificate. I think they want to know about that too. Reason being, with the Veterans Marriage, we'll go back to that one. There are services that are available for both the husband and the wife. One of the ones is in the burial, the death and burial. I'll get into more coverage of that a little later, but both the spouses are covered for that. And we'll get into what is and is not covered under that burial as well. There's a lot of myth behind that one too. Another is the Veterans Death Certificate. If the vet passes away, Veterans Affairs needs to know about that. One, for their records, and two, so that they can close the active case, the active files that they have on that vet, but maintain it open for the surviving spouse. Because there are provisions within Veterans Affairs where the can continue receiving the compensation that the veteran was receiving even after he or she passed away. They have provisions for that. And it's an important one. And a lot of vets don't know that that exists either. And that's another one of the ones that I really put emphasis on teaching to the vets when I get to come out to them. Service-connected disabilities, like I mentioned a little earlier, anything that occurred. A lot of the times people take service-connected disability as something that had to have occurred in a combat zone. It did not have to combat zone. It can occur anywhere. There's a lot of people, something that's considered that would be a service-connected disability that has truly nothing to do with the military whatsoever. Let's say a lady's in the military, gets pregnant, she gives birth, but then she decides she doesn't want to have children anymore and has a hysterectomy. That hysterectomy is a service-connected disability because it happened while you were in the military. Here's one. This is one that I think is comical, and this one was related to myself. I went into the military. I did not know I was allergic to bees. I'd never been stung by one, so I wouldn't know that I'm allergic to one. While I'm in the military, lo and behold, stung. Up, and I look like, if you ever saw the movie Hitch, when he ate the shellfish and his head swole up and had lumps and looked all kind of goofy. Well, that was me after the bee sting. Lo and behold, guess what? That bee sting and my allergy to it is a service-connected disability that had absolutely nothing to do with the military, but it occurred while I was in service. Anything that occurs to the body while in the military is a service-connected disability. If you went to the dentist, had a tooth removed, there's a possibility that too can be a service-connected disability. There are the list of ways and means of you getting rated for something are relatively endless. All that it has to be done is filed and claimed. And I always tell people, like I said earlier, getting to 30% is the goal. 60% is even better. Once you get to 60, other than dental, you're going to get, and you're really going to pay for nothing. But one of the best benefits of it is a whole bunch of 10 claims add up, and they're not hard to get. Some of them you're going to get almost immediately, but it's all a matter of claiming them. And then the amount that you get rated varies with the degree of disability and the number of dependents. Remember earlier I was talking about how it had the marriage certificate? That weighs into how much you get paid and compensated each month. Let's say you're married, 3 children that live at home. Those are all dependents. Let's say you're married, your children are grown, but your grandchildren, some reason, live with you. Guess what? Those too are dependents if they live in your home and you have custody of them. But these amounts go up as the dependents go up. And also something else that's a great feature in there with the degree of disability. If you have disabilities, like I'll use again myself, because I have a skin rash that's on the back of the neck from exposure, and I have a cream that I have to put on there. That cream, according to Veterans Affairs, causes damage to my clothing. So I'm compensated with what's called special circumstances because of the cream. On top of that, once a year, every August, I receive a clothing allowance from Veterans Affairs to replace the clothing that was damaged by the cream that I utilize on my neck. Veterans Affairs got sued because there were vets who had multiple devices, like knee devices, back braces, and they would only get compensated for one. Veterans Affairs lost that case. Now it's said that for each item of equipment, devices, creams, and they can do any form of damage to clothing, you're compensated on that annual a year, and you get compensated for that for your clothing allowance. Last one I believe we received last year, because I get it for $3, and it was a little over 800 and some change that I get every year just to replace clothing. Okay, but a lot of vets don't know that that exists. And if you have a knee brace, back brace, there's an extensive list of things that are compensated for as special compensation and given a clothing allowance for from Veterans Affairs, simply because something happened while you were in the military that caused it. Now, this is what they give monthly based on what the rate of disability is, and with no other factors involved at all. These are just their raw numbers as to what's received every month, tax exempt. Now, I always tell people, 10%, that just seems so low. It's only $127 a month. I always tell people, I don't know about you, but I would love to have an extra $127 a month just because for the rest of my life. So it begins there, but the numbers, as you see, go up higher. Now, they have, rates are going to be considerably higher, depending upon cause of injury, the number of children, your family size. I've seen where people are receiving in the 100% range. The amount that they're receiving monthly is in the area of $45,000 a month, indefinitely, separate from whatever they're receiving from retirement or whatever income that they earn. When I was working at Veterans Affairs, one of the things that I thought was like, you've got to be kidding me, was a guy who was in the military. He went through basic training and AIT, never served a day after that because of some form of trauma where the drill sergeant was yelling at him and he had developed some kind of a complex. I've never heard of such a thing. And he was rated at 100% PTSD. He was 19 years old. Now I'm sitting here and I'm like, hold up. I was in the middle, I'm retired. I was in there and I was like, I got shot. I'm blind in one eye, deaf in 1 ear. I have bullet fragments in the brain, a pin in my shoulder, and at that time I was at 60%. I have a little problem with you getting yelled at by a drill sergeant and getting 100% service-connected disability, and you didn't really even serve in the military truly. You were in a training facility. And I was like, and during this time, I'm not even going to compare the times of service in the military when basic training was really basic training, and where it's not like a country club. You go in there, you get a timeout. It's another sermon for another day. But I say that young man at 19 years old was receiving collectively about $200 a month for the rest of his life. I don't think he's going in the workforce anytime soon, because why should he? Why should he? And as I look at it, 19, and they're going to tag me with 100% service-connected disability, I'm not going in the workforce either. I would be doing this, but I would be doing it even the more so, and tell you how to use it. But these rates are great supplements to any income for the rest of your life. One of the benefits of this is secondary. I'll get into a little more detail of it a little later. These amounts, there are provisions inside Veterans Affairs of how the vet dies. These amounts that were being received will continue to the spouse for the remainder of their life. What's that? Perfect. I'm going to get to those a little later. I have some slides on those. It's not a done deal. It takes some time. It takes some time. But there are ways that it doesn't take time, and I'll get into those as well. The nursing care programs, one of the things about this that I love, we have veteran community living facilities. As an example, I can speak from where I live in Lake Nona Hospital in Orange County, in that region. They have that kind of a facility on location, and it's an incredible one. Where I was over there, the facility was phenomenal. The thing with it is, the moment it was done, complete, and the space was available, it was full. One of the things that I found that I thought was almost comical was when the Orlando facility was being built. They were building it based on the number of veterans residing in the Orange, Osceola, Lake, and Brevard counties at that no projected growth. So let's just say, using just raw numbers, these aren't actuals, but just to make an example, at that time, there were 100,000 veterans living here. So they built a hospital facility and everything that was based on that number, ignoring that the people in the military are getting out, and people who live in the northern states that are already retired or former military are coming down here. So the moment it's built, maximum. Same mistake they made with the Tampa facility. The other second phase. Let's consider this whole table right here is the entire area where there's property available. Veterans Affairs chose the purchase plot of land. There's a plot of land here, here, and here that they also should have purchased for growth, but they didn't. As a parallel that was done correctly, Nemours Hospital, which is also over there, they purchased this spot. They also purchased this, and this. Since I retired from there, and this was back in, this is 19 now, this was in 2015, I retired again. Construction, they had their main hospital facility and a gigantic parking facility. What's over there now? 4 buildings completely constructed, and they still have land because they built with the projected mind thinking. Well, Veterans Affairs didn't do that. They built based on numbers I consider that a bad move. If I wish I could have gotten that meeting. I would have said, this is foolish. You got to look forward. What also exists is there are state veterans homes. Those are provided by the state of Florida. Those, similarly, like the federal, but with a different reason, get filled. What causes them to get filled so quickly is the federal government side fills so rapidly, it spills over. Florida residents who are veterans are making use of it, but they did not anticipate the federal government overflowing the state overloads them. Then you have the community nursing home program. Those are companies who are in the private sector. Now, there is a litany of those that are out there. There's ALF facilities all over the place that are very well run, very well maintained, that also serve in those exact same capacities. And Veterans Affairs has provisions that make those available to the vets, and the Veterans Affairs pays for it. Oh, I'm sorry, an assisted living facility, retirement homes. And they operate in the exact same capacity, and will operate at no cost. Then you have organizations such as ours, being VITAS, when a person goes on and they're in one of or any of them, come into there and provide services for them and cover those costs because we are their hospice provider. So there's numerous means of getting into any of these types of nursing home care, or even if you're home-based, there's still means of even provisions being provided from that as well, because Veterans Affairs has home health care that's available as an option. Now, that's a great benefit. Now, when you talk about a whole lot of paperwork, home is a whole lot of paperwork, but the result is a great benefit because then you have a medical team that comes and cares for that veteran in their home, as well as allowing them the provisions of having a lot more comfortable life and at no cost. The biggest piece of it is filing for it. And a lot of people, well, how do you qualify to file for home health care? I couldn't even begin to go down the list of the rules with that one. That's where, again, anything that you're going to file, I strongly recommend that you go make use of a veteran service officer, a VSO. Now, those are located, as I mentioned earlier, in all the counties, but they're also located in veteran assistance organizations like DAV, Disabled American Veterans, Veterans of Foreign Wars, you name it, they almost always have one, a VSO, who is certified in there to do those same filings and do them electronically. And they're well-versed in how to get those things done. These benefits are priceless to the vets, and it's something that I believe should always be done as soon as possible. Even if you don't need it now, begin it so that if you do need it in the future, you've already pre-filed for those types of provisions to be given to you. These are the criteria that you have to meet with regard to getting the nursing home care. They're quite self-sufficient, and what it is just you have to be able to be medically stable. If you're not medically stable and there's something that's wrong, then that's unfortunately when hospice comes into play. That's the second phase of it. But these are what the criteria are. And virtually anyone, I always look at, if you were a veteran and you have aged, you become eligible based on this criteria. So it's just a matter of filing for it so that you can receive it. This one right here is what makes it happen even the faster. You don't have to be at 60, but you do have to have some form of a service-connected disability. As I mentioned before, getting a service-connected disability is not a difficult thing to do. Going and filing for it. You go to sit down and speak with them, as an example, about filing for a claim. They're going to ask you a whole barrage of questions, kind of like an interview. Did you ever carry weight above 50 pounds? Did you ever walk distances greater than 2 miles? Did you ever do this or did you ever do that? Virtually every one of the questions that they're going to ask you is a yes. Yes. Did you ever hear loud sounds? Did you ever hear an extended period of loud sounds? Subjected to impact? Any of these things. One of the ones that's even the more common is PTSD. There's a myriad forms of the types of PTSD that are out there. It doesn't even have to always be combat related because there's types of it that outside of the war zone. But it becomes what gets you into nursing home care. Now, this is when if they're enrolled in hospice, they're going to get nursing home care, be it from an inside organization being Veterans Affairs or from one like ourselves at VITAS. You will always have access to that, and those come at no cost to the veteran. Earlier, just a second ago, I was mentioning the home health aide. This is because what this one does is when the veteran is going to have the staff coming to their homes, they have this thing, no double dipping. What that means is you can't go trying to different sources for the same thing. It's kind of like you can't have both. It's kind of like you can have water or tea, but you can't have water and one or the other. But these are involved anyone who is enrolled. Now, the enrollment process, it takes some time. A lot of times it's anywhere from 2 to 4 months before all the paperwork gets done because there's a lot with regard to great health benefit. This is another. Remember earlier I was telling you that there's ways and means of income being given to a family who now this one is what's considered a pension. It's an amount of an amount that gets determined by a board based upon the circumstance and their income level. With this one, you didn't have to serve in an extended amount of time. You just basically had to serve 90 days. And I always tell people that means you survived basic training because most basic training is 3 months. Once you get through basic training, you become fully eligible for this in your later part of life. This also gets you a great piece of assistance that's a parallel to the home health aid because you will get free aid and attendance in your home if they become eligible for their pension. Now, there are really cool benefits and perks are the ones that are if you're bedridden due to any of the disabilities that are significant. That is another gateway to getting you to that benefit. Yes, ma'am.
I just had a question.
Sure.
Free aid attendance. Does that mean that the person who gives the aid attendance must accept the VA rate, or you have a copay over and above that if they charge more than the aid attendance pays?
What she's asking is if you have to pay a rate with regard to receiving the aid and attendance based on a.
If it's a service that accepts assignment of.
Correct. Or is it something that's a service that's accepted? There is no cost to the veteran for that aid and assistance. It's going to be health care, the visits, nurses, by CNAs that are going to come to the home and perform chores and tasks that the veteran can't do himself and their spouse isn't capable of doing it all, or just needs relief, a break, because it can be stressful. Yes, sir.
Did you indicate you can apply for that?
Yes, you can, but to pre-apply for this to be as over 65 and older first to even qualify, unless significant service-connected disability. If it's believed by the family, let's just say my wife and I, and my health, I'm having some serious problems, but I'm not yet at the point where I would be eligible to receive this one yet. She can still begin the process of applying for this one based upon my condition and what my doctor is saying it's going to become. That gets the paperwork rolling before I reach that point. It's a precursor to it. You can also, which is an amazing benefit, and I'll get to that and go into a little detail, with regard to burial services, you can begin applying for eligibility for that one the moment you get out of the military. You don't have to wait until the vet passes away to begin the processing. You can get what's called predetermination years, decades before that actually occurs. So virtually everything the VA offers, there is a pre-methodology of getting the criteria met long before you actually have the need of that particular service.
Even if you're not considered low income.
Correct. Now, low income, this is that's one of the rates. Low income is a good term, good question, and I don't know if you meant it that way, but it's a good term. What is low income? Is it $20,000 a year, $40,000 a year? To be honest, that income being low is determined based upon the demographics of where you are. Meaning, if you are living in New York City, a low income there is not the same as a low income if you live in Umatilla. The demographics are different. And because of that, it gets measured based upon where you are. I couldn't give a static number as to what, quote unquote, a low income is. It's a matter of filing and finding particular Veterans Affairs what it is for that particular area. A lot of the things that Veterans Affairs does is truly based upon demographics, and that's how they get their study as to what the cost is. The pension that's received for a veteran without dependents, this is what they would receive a month. And it goes up as well. If there's more dependents in the home, then of course it goes up higher. But that is a nice supplemental income just based upon the fact that it's a low income family. And they're also not going to have the cost of medication. Yes, sir.
Sir, when I received an 8G rating, which basically it said you made way
Too much money.
Do I have to now go back and reapply?
Unfortunately, yes.
Okay, no problem with that.
And it's a matter, and I believe I have in there one of those documents, there's a toll-free number. If I don't have it inside of there,
Just go to Veterans.
correct, then you can file for it there. Mhm. Water is always good. Aid and attendance, as I mentioned before. It's done and where the veteran needs assistance with daily activities, bathing, dressing, and also medical care. And they come to the home and assist in that provision. This is also done at no cost. This is something that they file, that you can file and claim and get assistance. This is the one that also I said takes 2 to 4 months for it. Reason time is the Veterans Affairs is a big organization. If they themselves can't provide it, they outsource it to an outside company that comes in and does it for them. So it is an incredible benefit that goes with assisting the spouse with the care of the veteran. That are on the aid and attendance, they will also receive a supplemental income to that family. Reason that's being given is because the veteran and their family, they need assistance. And it's usually not only because of the pain and suffering for lack of the care of that veteran, it's also a drain on their capital. So you also receive that one as well. Yes, sir. Do you have a question? No problem.
Well, I guess
Sure.
I could ask one. Is there any help for the spouse if except for the veteran, if the spouse is disabled?
They do have provisions for that as well. Do provisions to allow aid and attendance for the veteran's spouse and not just for the veteran. It's primary for the vet, but under circumstance, and this is when it comes into cost, whether they will give it for the spouse. They do have it as a possibility, but it also depends upon the need within the particular demographic. I have seen where the spouse is receiving that type of care and coverage as well. And it usually is when the extenuating circumstances are that the veteran himself or herself are not fully capable of caring for that spouse. Yes, ma'am.
If the spouse is taking care of the disabled veteran,
Mhm.
there are some compensation as well, but how do you apply that?
That goes in when you file for the aid and assistance. When you file for aid and attendance, that gets automatic.
Yeah, and it depends, if the spouse has to give up her job to take care of him, some of that takes into consideration and everything.
Correct. One of the things that gets brought into play, and the reason that is because it's more than that one person can actually handle. And a good portion of the aid and attendance give a reprieve to that spouse so that they're not so overwhelmed, because it's a lot of, it's,
Well, that's respite care.
correct.
Care is provided under that home health care thing, but I'm talking about when the spouse takes care of the disabled veteran herself.
Correct. And when they come there, they take care of a lot of the daily activities to take that burden away from, it's like a respite. But this is one that's being given where it can be applied on a daily basis necessary, because that's something that's provided from Veterans Affairs. Yes, sir.
To what degree do these aid and attendance become available for military?
It depends upon the medical need of that family, and there has to be, again, the aid and attendance comes into play when there is an immense amount of stressors, for lack of better words, on the spouse for the care of that veteran. It's not something that's just applied because the veteran's retired and there has to be a need. And they do an assessment. The form, like I say, when you apply for it, it's a long process. And what they're looking for is, why do you need aid and attendance? And first thing they're going to want to know is it a health benefit, or is it just something you want just because you want it? You can't get it for that. It has to truly be a health cause and a stressor that's up on the spouse. You can't meet that anymore.
What about for the spouse after the retired military vet croaks?
That one I'm not able. I don't have an answer for that one. That's a high level question. I would address that. That's a VSO type question, because that's getting into the nitty gritty of the policy. I would want to say that it's a yes, that they assist them while the veteran is still here, but I can't answer that one conclusively to say that the same after the veteran passes away. That would definitely adjust that one to a VSO. Definitely. Yes, ma'am.
I'm kind of hung up on the low income. It seems like if you're 65 and let's say you're getting Social Security check or something, it might throw you out.
That's where the complication comes from of what is considered a low income threshold. And it varies so widely. As an example, the threshold here in Lady Lake is different than what it is in Claremont, as well as anywhere else. So each particular area has its own threshold, and it's hard to measure what that would be. As a parallel, if I'm living in Claremont and I make $50,000 a year, that's a sizable income inside of Claremont. But if I live in Miami and I make $50,000 a year, that $50,000 is not carrying me the same way. Threshold is different, but it's the same amount of money. Where city comes into of governmental bureaucracy, because they have to do assessments. And they have to do value worth, what they call it, where they measure the worth and value of the property that you own. If equity, that's going to become part of the asset that gets measured into it as well. Because then they'll say, well, can you take money from there as well? And if no, then okay, since you can't take it from there, then we can erase that one from the equation. They have a long process of their evaluation. That's why it takes them 2 to 4 months to go through it, 'cause it's tedious. It's both. They consider both.
Excuse me,
Yes, ma'am.
this may help someone.
Sure.
About aid and attendance.
Mhm.
If you go to the VA medical clinic, you have a primary care doctor there. They will ask you all these questions about, can you bathe, can you, blah, blah, blah. And they will set the wheel.
Precisely. Whenever you visit a VA facility and you see your healthcare provider, what you tell them also weighs into quite a few things. It's evaluated as well. As an example, let's say a vet's going to go and claim PT, and they're going to say that they have trauma. But for the past 4 years, you've gone to see the doctor, and one of the questions they ask you is, how's your stress level? And you say, well, I'm fine, I'm great. So you've shown a pattern over a good period of years that there was never anything mentioned. You never went to see mental health. You never addressed it with anyone. That can become a barrier. So I always explain to veterans, be honest with how you feel when you get there. I do. They say, well, how do you feel? I'm going to tell them the truth. It's always pleasant to say, I feel great. Everybody wants to say that. But is it true? Tell the truth. And because it gets measured in the future when you go and get services from them. If everything looks all peachy keen and you go in and you claim that there's never anything wrong, I'm in optimum shape, excellent health condition, my diet is superb, I have nothing wrong whatsoever, and then you claim, my back hurts. When did that happen? It's a matter of, if you feel the pain, address it, make it known, and get it documented, be it from the outside or within Veterans Affairs. And with anything that's going to be a gauge towards financial and information that you receive. Going back to not lying about your income, when you apply for aid and attendance and people try and hide the amount that they earn, they do what's called a 5-year look back based on the same system that Medicaid uses. They're going to find it. And that's something I always tell them, don't lie about your income. Not only will they check what was received, they're going to also audit your bank account. If you're claiming, well, no, I'm making $25,000 a year, then how do you explain that you've deposited $60,000 over the year? Where did that come from? Not only are you making yourself exposed to Veterans Affairs, you're making yourself exposed to the infamous IRS, because when they come knocking, they're not going to be friendly. So with regard to anything regarding finances, lie, be honest with them, be straightforward, and everything goes forward. Aid and attendance is where they do the most diligent search on how much you earn and make, because that's an extremely expensive benefit. Diligent in how they go about doing it. Burial and memorial benefits. This is one of the ones that I mentioned a little earlier ago. This is something that is eligible for not only the veteran, but their spouses and their children can all be buried at no cost in any federal, like Bush. The veteran also doesn't have to predecease the spouse. If the spouse, for some reason, passes before the veteran, they're still eligible for burial. Cemetery. Same thing with their children. They're also eligible for burial in there. Now, here's where we get into that cost part and what it is that you actually get and what you do not get. A lot of people have the belief that the VA takes care of everything. No, they do not. As an example, the funeral services are not covered by Veterans Affairs. You're paying for that yourself. But there are provisions that can allow you to be reimbursed for some of that cost. A lot of the other services, such as flowers, invitations, things that are not covered. What is covered is the gravesite itself, closing of the grave, the headstone marker. You can also get a seal on there based on the branch of service that they served in. That's something that can be requested, as well as the burial flag and military honors. Those are all provided. The external costs are not. Anything else that you want to have done at that funeral is at your own expense. What you also not listed here is the casket, because the casket is not provided. Only the burial. Yes, sir.
Who makes contact with the VA in order to get this organized?
His question is, who contacts the VA to get this organized? Great question. Remember before I was talking about, I had briefly mentioned, there's a lot of things at Veterans Affairs that you can pre-qualify for long before you need the service. Burial and cemetery placement is one of them. They have a predetermination that can be done decades before the veteran passes away. It's a matter of filing the form for burial pre-qualification. What that is, it takes all the red tape out of the way, and it only takes about a month to get done. What that does is you're now pre-qualified. Everything that's going to be done for your burial is already set. And when the day actually comes, when the passing happens, the transition of forms, it's not going to be as many having to be done because they were already done long before the burial happened.
Okay, but does the funeral director, if it's a civilian,
Yeah. They are every one of the people, and there is not a funeral location in the country that doesn't already know how to handle the veterans, the filings of it. But if it's already pre-qualified, they can the veteran's having spouse can bring in to that location that they're already pre-qualified, which will expedite getting everything done that needs to be filed for the burial. Yes, sir.
Eligibility for determination for burial, try 9 months.
Yeah, that's why if you don't have qualification and get that over with beforehand, VA is a governmental agency. That's why whatever you're going to get from them, do it as early as possible to get it out of the way. Otherwise, it's going to be time consuming. The document itself is located, if you go to va.gov, va.gov's got every document known to man. You can go into va.gov, to the search bar that's up there, burial pre-qualification, and you'll get the form to come up.
is there a special Arlington National requirement?
Getting buried, now, the primary is normally going to be within the state that you're in. His question is there a pre-qual, or is there where you want to be buried, which type of federal burial facility you want to get placed into. Getting into Arlington is not an easy one because they have high-level criteria to even to get buried in Arlington. You had to have been either like a president or you received a high level of valor, and then you still have to apply. So getting into Arlington is not an easy one, but getting into any of the other ones that are at the states that are also national cemeteries, that's an automatic given. Yes, sir.
He wanted to be buried in Arlington.
Mhm.
He's cremated, burial, a company that created
Correct. I didn't. That's coming up. I can get to the cremation part, but yes, cremation. They have a different facility at virtually every national cemetery. Where when a person chooses cremation, they have a location where they the ashes inside of a wall that gets a seal placed onto it. They have massive space for that. But anyone that wants to be buried, placed into a burial site on the ground, Arlington is an extremely different. There was another. Yes, ma'am.
You don't have to in a little mailbox. You can also be buried in the ground, right?
Correct. Correct. But if you want to be placed in ground and cremated, that comes by space. Then Arlington is not going to work. Yeah. Arlington and ground is different.
So you have to do it, you almost have to do it for a specific site.
Well, not when you do your pre-qualification. That's just to qualify you for burial, period. But then where you choose to get buried is something that you can determine after the fact. I have numerous vets, as an example, that I've met where the veteran passed away here, but they want to be buried in Michigan, which was their home state. So so their body will be transported and buried there.
Now, do you get a form that says you've been pre-qualified?
Yes, they send that to you in the mail. Yeah. Getting that one done doesn't take that long because
Transportation cost to that site is up to the family.
it's up to the family and there are provisions for getting reimbursed. I'll get into that in a moment.
You had mentioned earlier VSO, Veterans Service Organizations. Is there one that stands out better as a very good one? I went to one in Ohio and they tried to talk me out of moving forward, so they were trying to get me off it.
Before
Yes.
you answer
I'm
that.
speaking, sir. Is there one better than another?
The one that I like and that I use, I live in Claremont. I use the one that's in Tavares, simply because the ones that work in there are diligent, and he is a senior VSO.
Is that a county organization?
It's county, but you can use any. I could go over to Orlando and use one in Orange County. Where you reside is irrelevant.
County, and then there's the Veterans of Foreign Wars, there's different organizations.
Correct.
that provide that service.
Correct. Any of the veteran organizations have one of them in
You haven't found one that stands out, find an individual that you like, is what you're saying?
the one that's in Lake County. I would highly recommend that one. It's in Tavares.
And it's in Tavares.
It's in Tavares.
I was gonna mention, the VA here in the Villages
Mhm.
had a senior VSO.
Okay.
The gentleman was excellent.
That's Louise. He's from the Sumter County one.
He retired.
Mhm.
Okay? The person whose place,
Yeah, that was Louise. I remember Louise when he retired. I remember him. He was really good. But I can say for certainty, any one of the county VSO, because when the bulk of the are in Lake County. I'm moving into the Sumter area. Up here in Lady Lake, you're at the cusp of Lake and Sumter. It's like, I think your city is split in half almost as to which county it's in. But
We can go to Lake?
yes, you can use any VSO office, and it is a highly effective system. If you go into Google and you just key in Lake County, Florida, VSO, it'll give you that location, give you the address and everything. Just give them a call, make an appointment, come in, and they will begin working to assist you. It's a great service. Yes, ma'am.
When you go down to the cemetery itself, is there anybody down there? I know we've been in there a couple of times, and they have a big office, and they have other back rooms. Is there anybody down there that if you went or called for an appointment, that you could go down to the actual cemetery where you're planning on going?
Like, say, Bushnell as an example. Oh, yeah, they have a VA representative, and they have a whole facility into the location. Speak to the VA representative. They can give you a lay of where everything is. They have a nice little display in there of how the cemetery is set up.
One other thing, it's easier to, like if somebody passes away, like my mother-in-law passed away, her husband was in the Calverton out in Long Island.
Mm-hmm.
And we actually, from the funeral home, they gave us the ashes. Back then, they wouldn't fly it up. They had to put you in the first class section.
Mhm.
Now, you're allowed to bring the ashes up to the cemetery. They
Okay.
And that saves a lot of money. People don't realize that you can really do a lot of these things yourself.
Well, correct.
You don't need all, if you're creating this company that you're working for, you can plan ahead and do it without the funeral home.
Correct. Correct. In the event that and their family want to get buried in a private cemetery and not use a federal facility, a lot of what was listed before goes away because now you're not on federal ground, you're using private. But what they do give is the headstone, a medallion which gets placed in the lieu of a headstone because they really look nice. They'll place inside of them. They give the military funeral honors. You'll still get the firing squad that shows the flag. And that for those, that's only the veteran will receive that. Will not receive any assistance on theirs when they pass away. That would only be exclusive for the veteran when it's in a private cemetery. I mentioned a moment ago that there are provisions for reimbursements. VA has a plethora of, well, we have this also, and just in case. And then, well, we have a subclause just in case too. The event that the veteran passes away and the cause of their death is on a service-connected disability. Again, I can't emphasize enough getting claims filed for injuries and illnesses and anything that occur while you're in service because the cause of death related to a service-connected changes things into the financial world. Now, if a person is 100% service-connected, it's what the cause of death was because 100% means that covers everything. Pass, then what happens is that veteran surviving family receives a compensation of $2,000. I also mentioned before that certain things such as the funeral and reimbursements of some of those costs, they don't take care of those as well. Well, they have a what-if clause for that as well, that you can be reimbursed up to $700 allowance if that veteran was hospitalized by the VA at the time of death, or $300 if they're receiving pension. Now, when it says hospitalized by the VA at the time of death, earlier I mentioned the change back in October that stated the way it works is you would have to go and see a VA supplied health provider, and that would be your primary health provider. What they created was a provision that allows vets to have choice. And they have provisions as to what would cause that veteran to make use of a choice of an outside provider and not a VA-assigned primary health care. The first provision is the appointment date is greater than 30 days away from the time you made the call. If the appointment date is greater than 30 days out, you are now eligible to be referred out to an outside. That's the first. The second, the distance is greater than 50 miles for you to get to that location. If the distance from where you reside to that facility is greater than 50 miles, you are eligible to have a personal choice for regular outside healthcare provider. And then the third, which is the easiest of all three of these to get, you just don't have a means to get to that location. It doesn't matter where it is. It could be 10 blocks away. I don't have transportation to get there. I need the one that's across the street. That's the provision. Those are the three that give veterans the option of an outside provider that the VA will pay for. Once that occurs, and let's say Dr. Susan says you need to be hospitalized, that equates to being hospitalized by the VA because that outside provider was a VA authorized physician who referred you to hospitalization. And from whatever that hospitalization was, led to death. That gives that compensation of $700 burial. Yes, sir. Oh, no problem.
I was just saying, most of that applies if you're not on, Medicare.
Okay. They also have, now this one right here, I have only a couple of them on here, but there is a long list of things that would make a person at the time of death qualify for receiving yet another $700 plot allowance. Just a couple of them, but there's criteria that fit into receiving the type of additional compensation. The other is if the death occurred under VA care. That's one of the easiest under the sun. If you are registered with Veterans Affairs and you have a primary health care provider, that is I was like, it's just having a doctor. gets to this portion of it. And when that happens, some of the cost of transporting the remains from one location to another location becomes reimbursable. Yes, ma'am.
A question I have about that was, my husband was buried in Kentucky, but he would have preferred to have been buried in New York, where he had gone to college, and it's a national cemetery. Would they have potentially have reimbursed part of that if he was 100% disabled?
He wouldn't have even had been 100% disabled for that. It would have occurred under the care of a VA. As long as you're being cared by a VA doctor, a portion, the entire, but a portion of that transport would have been.
Do they have a VA advisor at the VA hospital?
The question was, do they have a VA advisor? That's a yes answer. They have a patient advocate who is supposed to work on your behalf. Now, I will say, the one at the VA hospital in Lake Nona, I can attest, Deborah Ward is her name. She is off the chain when it comes to what she does. Her at the VA hospital in Orlando, it's at Lake Nona, near the airport. That's the major facility for this part of Florida. Deborah Ward she is incredible with how she handles things. She does same day. If you come in as an example with whatever the concern is, she's gonna take the information and submit it that same day. It's not gonna take days. And then not only that, she's gonna follow up with not only you, but with whomever it was that you had the problem or concern or whatever it was with. I know, because I worked with her while I was there. She's moved up quite a bit, but she's still in that department of being a patient advocate. Very effective. However, not all facilities have someone who is that proactive. She happens to be a veteran. She's retired Army, just like me. So her heart is in the service of the veterans. Sometimes you get someone in that capacity, it's just a job. They 9 to 5, they're going home. And if something doesn't get done, something doesn't get done. And it hurts that exists within there, but it's there. So that's why I say there's a yes and a no answer to that. It depends on who it is that's running, but they do have a patient advocate that's supposed to work always on your behalf, always. Let's say there's a scenario, the veteran and the wife, or the spouse, I won't say wife. Excuse me for always saying wife, because I'm a male, I have a wife. It's veteran and their spouse. The vet passes away, and the spouse is receiving benefits or an income because they were married. And then for some reason, that particular spouse chooses to get remarried to someone else. Everything they were receiving stops because you're now someone else's spouse. But the funny part with that is, if they get divorced from that second spouse, it starts back up. As long as you're not married to somebody else, it can keep going. Married again, it stops. As long as they don't remarry, they will be eligible for burial in a national cemetery. If they're not eligible for burial, if they get divorced, they become re-eligible for burial in a national cemetery. Everything that they would potentially receive from that, if they were still here, they would keep getting as long as they do not remarry. So I always tell people, your heart, your wallet or purse. No more. This is another that's an this benefits.va.gov. That's another one that works just like the first one that I showed you in archives. This one works directly off of the VA site. From this one, you're able to get countless letters from Veterans Affairs, or a myriad. I mean, the things that you can use that one for your property to take to the county collector, they have a letter for that one on there. If you have health care that makes you exempt from the Affordable Health Care Act, they have a letter that states you're receiving health care. Go pay for that. They have, you name it, in there. On this site, if you wanted to do your own filings for service-connected disabilities, you can do all of that on direct. It's electronic, and there's going to be an electronic signature given to it. That e-benefits, I recommend to every veteran to go to that site and register. Simply because what you're going to get from there is priceless. Inside of that e-benefits, it's user-friendly. I sit there every time I go and see that particular site. When I use it myself, I'm blown away. Why don't you make everything that easy? things should work the way the e-benefits site works. You don't have to have a doctoral degree in micro usage as an electrician, because it's simplistic. I think that they made that site using like a 6 mindset. So I was like, wow, I mean, it's so simplistic. If I can get it, anybody can get it. But and I always recommend that everyone go and make use of that website. You can go to the Florida Department of Veterans Affairs site. There's a whole lot of information on there. But one of the ones that I always strongly recommend, if you have any service-connected disability, a service-connected rating, take the letter that you can get right there from the e-benefits to any of the state parks and make use of that state park entry. Another benefit, I didn't put it up here, but it's one that's really great. If you're service-connected, if you have a service-connected rating of 40% or higher, become eligible for a free lifetime pass to all of the federal parks, federal, national, state, the national state parks, nationwide. Now you have to pay $6 for them to mail you the little thingamajiggy, but life. And also the one for the state parks, that's for life. That was put into place by Governor Rick Scott when he was in office for the veterans, that for the remainder of their lives, they have access to the state parks. It's an incredible benefit. As I mentioned before, the county VACs, as they call them here, Veteran Assistance Commissions, these are where the VSO is. VSO has 2 different meanings. They have it as Veteran Service Organization and Veteran Service Officers. The Veteran Service Officers are inside of VACs. Just Veterans Affairs has 9,000 acronyms. They love using them, interchanging them. Happens once you get enrolled at Veterans Affairs. Getting enrolled at VA is a priceless tool. Ironically, you can even go to e-benefits. If you're not registered at Veterans Affairs, you can register for it on e-benefits to begin your process of getting into the system. Once you get that done, I always look at the gateway opens up for a whole. One of the ones that's a great benefit is whenever a vet passes away. I mentioned before how pension or any income coming in from Veterans Affairs can roll over to the spouse. When that vet passes away, if what they passed away from was related to a service-connected disability, no matter what it was, income goes over to the spouse even after the vet passes away. And what happens after that's done, the family doesn't have to file anything because the veteran's benefit immediately contacts the VHA, and they begin the process of continuing that payment to the surviving spouse once is made. However, if you're 100% service-connected, it doesn't matter what you died from. It will automatically roll over immediately. And
Roll over in the same amount.
correct. It'll get, the dependent amount's not the same anymore. It's where it was before, 2, it's now 1. But it's still a life assistance for that surviving spouse. They're not left alone. Yes, sir.
Did you say that it has to be 30% or more before it goes to?
No. It could be anything. If they have 10%, yeah, let's say if they're getting 10%, it's $100 a month. But that's what it was that they died from, then yeah, it carries over. Yes, ma'am.
It may have changed. But
Sure.
I have read that if a spouse, if a veteran is 100% service-connected disabled, when they die, it has to be 10 years from the time that they were.
Initially filed.
Yes.
Correct. It is. Unless the injuries or illnesses were directly combat related. If it occurred, they got hurt while they were just doing their service on base, that's when it's the 10-year cause.
Your letter only says service-connected. It doesn't say combat or otherwise. It says.
Correct. But when that injury occurred in a combat zone, that's a different category.
No, I'm not talking about when the injury took place. I'm talking about the termination that you were disabled took place. When they made that decision.
Correct.
It has to be 10 years from that for the spouse to receive the deceased veteran. Correct?
Correct. Unless the cause of death in that 100% was a combat injury that was in there. As an example, using my let's say I filed yesterday and I just did my claim. I hit 100%. I'm rated 100% of different things. But the thing that took my life when I actually passed away next week, heaven, this is not a wish. But the cause that I actually died from is because of the shrapnel in my brain that occurred in a combat zone. The 10-year clause goes away because the injury was based in a combat effective injury. But if it was my back had nothing to do with combat. That was something in training. That needs the 10-year clause. Everything that the VA has, they have another clause for another. Welcome to bureaucracy. Yes, ma'am.
Where would be the best place here in Florida to go for a reassessment of combat-related injuries and eligibility?
I would make use of that Lake County VSO because the way they construct the claim, not only do they ask for get the medical records, they request them themselves because they'll go to the e-benefits and download your medical records with your consent, and then they're going to construct a narrative of how the injury happened. When you start doing it that way, what they do is they do a file that's called an expeditious claim. That's one that's going to get determined within 30 days because they have enough evidence or information to support the who, what, when, where, why, and how of the injury, so that that vet won't appear before a board. They'll make the determination without them even having to be there.
Does that include reevaluation?
Yes, sir. Yes, sir. The amount of evidence. Evidence is always the key thing. Always think of it trial. When there is an overwhelming amount of evidence of innocence, for example, they're not going to go to court because there's too much that shows they didn't do it. But if it's like, this is questionable, bring them in. I want to get that one on the stand. But when it's just, they got video footage, he was at home. While they had a video in there's another sermon for another day. But there was evidence that just showed conclusively they weren't there. There's no need for them to come. It's the same thing with the claim. When there's overwhelming that shows X or Y, there's no need for the claim. Yes, ma'am.
What about assistant living discounts for the remaining spouse?
What was the question? I'm sorry?
Assistant living discounts for the remaining spouse.
It's possible, like I mentioned before, but you're going to have to meet criteria. That's when you're going to need a VSO to actually sit down through the details of that type of a filing. Because that's when you get into the nitty-gritty of Veterans Affairs.
I did hear that of the assistant living places that have said yes.
Correct. With how to get those things done, but it's going to take a little time. Definitely. Well, I want to thank you all for coming out and spending a little time with me. This is some of the information we went over again with some of the listed information. This is a really good, I should have gave you this one too. He's a really good one. He's into land. The reason I like him, it's going a little further away, but I like him because I met him when I was at Veterans Affairs. We worked together. So he's another that is a really good representative. So I would say Lake County and Jeff Bum and down into land because they're really great officers. This, before we all depart, good friend, Christopher, he manages over the volunteers, and he has gotten me a couple of veteran volunteers. We were going to have one here with me today, but he had to work. I was like, but I'd like to bring up to you Christopher Shepard.
Thanks. Thank you all so much for being here. And just we appreciate that. Thomas job, doesn't he? I mean, he is so knowledgeable. And VITAS's heart is to be available to veterans and let you know your benefits. In every territory, we have a Veterans Liaison whose only function is to let veterans know their benefits and help connect them to them, whether they're on our services or not. An amazing thing, and that's been our heart from the beginning. And one big part of that is having veterans who volunteer with veterans when they are a hospice patient. And that doesn't mean that someone is imminently at death. They can be carry on a conversation, move around their home, do any kind of things. We need veteran volunteers in this area. And a veteran volunteer one time a month for 15 or 20 minutes in any way that a veteran volunteer would like, and it would make an incredible difference, the veteran or the veteran's spouse. So if you're interested, I would love to talk to you. We would prepare you. We would make sure that you could tell us how often you'd like to volunteer. Thank you again for letting us be here, and thank you, Jerry, and AMAC, and your hospitality.
You have a card?
I do. It's out on the and I'll be there. Thank you.
Okay, once again, I want to thank Thomas. This is our second seminar that we've done with Thomas, and I think we'll be doing more. He's an incredible speaker. So I would ask that you tell your friends and neighbors that have an interest in to watch our website. And when we announce the next one, we'll be happy to have Thomas back. So thanks again for coming. We appreciate it.